Good morning. I am so excited today. Sheena and I have our first guest for our podcast. She and I have been bantering for the past 6 weeks, and I'm so thrilled that Dr. Hilary Bassett is joining us today as our inaugural guest. So, welcome, Hilary.
Welcome, Dr. Bassett.
Thank you so much for having me. I'm so delighted to be here.
Yeah, and I'm especially grateful, well, for so many reasons, but I've had the wonderful opportunity to work with Dr. Bassett in her practice titled The Heart of Wellness is the name of her practice. So, that's got to be all about healing, right? If that's the name of her practice. So, we have a mutual friend who is a nurse practitioner, and her name is Lisa. And Lisa and Hilary were in a Facebook group together. This is the way I remember it. I don't even know, fill in the blanks, but they were geeking out and talking about medicine and functional medicine. Hilary was actually wanting to leave emergency medicine and get into functional medicine, and I'll let her talk more about that. And she was looking for a health coach to support her practice, to work with her patients. And so she and I met for a walk on this local trail and we hit it off. And I said, look, you can just try me for like 30, 60, 90 days. And if you don't like me or I'm not meeting your expectations, you can kick me out. So that was almost 2 years ago. And it has been really cool working with her because I have learned so much about the right way people should be treated by their medical doctor, and especially women in perimenopause and menopause. So I want to introduce my friend and coworker, Dr. Hilary Bassett. So tell us about yourself and how you got into functional medicine.
Well, thank you both so much for having me. I love following Beyond the Box Nutrition, and you guys are great role models and give so much incredible education to your community. So I'm very grateful to you both. So thanks for having me. Like Gwen said, yes, I come from the conventional medical world. I've spent almost 20 years in that world and trained as an ER doctor. And, I found myself a decade and a half into my career just feeling really disillusioned by conventional medicine and learned about functional medicine. I won't go into all of the details of how that happened, but as I learned about it, all of these light bulbs started going off for me because this is what I thought I was doing when I went to medical school, was really learning the root causes of disease. And yet conventional medical training really teaches us to name the disease, prescribe the pill, and move on to the next patient. And I was doing that every single day. And it was really unsatisfying and unrewarding to see people just end up on more and more medications, and we weren't really fixing the underlying problem. And so I decided I needed to change my whole career and went and got certified in functional medicine several years ago and opened up my practice. And I have Gwen that's been with me really since the beginning. And she really helps support my patients with a lot of lifestyle changes. And of course, nutrition is a big part of that. But yeah, my practice is mostly focused on women in midlife. I do have some patients that are not in that category, but that is a big focus of my practice. It's a passion of mine, menopause care. So I'm excited to have this conversation.
Great.
Awesome. Yeah, we have, I think, Gwen and I have been, obviously Gwen went through her menopause journey. I'm kind of in the perimenopause stage right now. So a lot of, our own experiences are popping up in ways that we like helping our clients. Yeah, I'm so excited. I have so many questions for you. How how does your care differ from what someone might see in the conventional, you go to your primary care doc or something like that, and I've got perimenopause symptoms. How would your care differ from what I might see with we'll call it just run of the mill GP?
Yeah, thanks for asking that. Well, I don't want to downplay all of my doctor colleagues, right? Like, this is how a lot of us have been trained, and they are often doing their best. And in the insurance model, they have very little time. So, the biggest difference probably is that I spend a lot of time with my patients. So, I want to get an entire full history, not just hey, you have perimenopause? Tell me all your perimenopause symptoms. I want to know everything about your health because turns out hormone health really affects our entire body. And in midlife, a lot of things start to kind of fall off in terms of our health and wellness. We start to have issues with sleep. We might have some labs that are becoming abnormal. And so women are very well taken care of in our reproductive years with pap smears and regular gynecology visits. We generally, feel like we're in charge of our health. And then sometimes we hit sort of our early 40s and a lot of things can start to change. And so I want to make sure I'm looking at inflammation, cardiovascular health, metabolic health, as well as hormones. So I'm really taking in everything into account. I don't just want to know about your quote unquote hormonal symptoms. I want to know everything that's going on because I want to be looking at all of the possible imbalances happening in your body because hormones play a role in all of it. It's really a symphony. And, we need to be looking at all of those pieces in order to, attain hormonal health and balance. So that's probably the biggest difference is I'm looking at everything and I take a lot of time.
Yeah, that's a really good point. I mean, I know we've talked to quite a few, of our own clients that's probably the number one complaint is when you go to your GP, you're there for 10, 15 minutes and you're kind of checking the box and then you leave and sometimes you leave with more questions than you had coming in. And again, you're right. Like it is the structure of what the parameters that doctors have to work with it nowadays does seem unfair. And it's almost like just no one's winning in that case, right? It's super
Yeah.
tricky. So
Absolutely. And I should also mention that you might not even know what you're having actually is perimenopause. So we should have backed up there. You might just be having palpitations out of nowhere. And so the tricky part with that is you might either go to someone that does recognize that that could be perimenopause, or you might go to your regular doctor and you end up just in this huge cardiac workup, which I'm not saying is unimportant. It is still usually, a key part of this. We don't want to just attribute everything to perimenopause because Instagram tells us that. But I think this really highlights the fact that traditional medical education does not include menopause education really at all. And that's a huge problem. And women spend, almost half their life in menopause. And this has not really been valued in conventional medicine or culturally. So I'll just, quick little soapbox that, in healthcare and in medicine and for women living in modern society, the patriarchy really cares about women making babies. And after that, we don't honestly care a lot about them up until now. And finally, menopause is becoming a part of the conversation. And thank goodness. I mean, not only do we spend more years in menopause than we do menstruating, but this is such an important time in a woman's life. And it is not like the beginning of the end. And I hope that we can kind of highlight some of those reasons why in this conversation, because this can be a really empowering time in your life.
that's the first time that has like clicked for me is that you spend more time in menopause than not, or than like that just light bulb went off in my head. Like, boy, but it went off for the right reason. I mean, I have two small kids and I'm 42. And I mean, I feel like I've got a whole life ahead of me with them, right? And like how do you want to spend those years? And especially with younger kids, like the first kind of symptom that scared me and kind of led me, I reached out to Gwen right away. I was like, I am so irritable with my kids and I'm so frustrated and I'm so on edge all the time that I know I'm not being the best version of myself, let alone the best mother to them or the best wife. Like it was so scary. And, I didn't want to spend a good quality time amount or like my quality years living that way. So that was kind of like, and you start diving into the rabbit hole of like, is this perimenopause or is this a mental thing? Like, is this more of I don't want to call it like a depressive thing, but like, I guess that's probably a good leading question is like, how, what is the process for kind of determining like what could be perimenopause, what's maybe hormonal related, and when is it actually more of like a psychological thing, maybe leading into depression, or maybe that's a very complex question. I'm totally just going off of personal experience here, but
Yeah,
I wanted to jump into it just because I thought it was something I experienced and I would love to hear how you
yeah.
would approach that.
It's a very important question, and thank you for sharing that. And I think what I want to touch on first is that what I'd really like to highlight for your community is that perimenopause, I really look at as it can be a roller coaster, but this is also truly an opportunity to tune into your own body and to realize that you are giving yourself so much to everyone around you and that you cannot do that without filling your cup first. And I think there's a lot of like, self-care, blah, blah, blah. But the truth is perimenopause kind of smacks you in the face and you end up kind of not really having a choice, really. All of the sudden, you have to prioritize your sleep. You have to prioritize nutrition and your movement and building muscle. And yes, it feels like a lot of have tos. So I would love to reframe that as like, I get to pour into myself so that I can be a better mom, so that I can not be as irritable. However, I also just want to recognize that irritability, mood swings, depression, anxiety, super, super common symptoms in perimenopause. And so many women, doctors, again, like this is conventional medicine, name the disease, prescribe the pill. They have 7 minutes with you. You're telling them you're irritable, you have low mood, you feel really down. I've got a prescription for that. So prescribing antidepressants and anti-anxiety medication they're very quick to do that. And it can be very helpful. This is a yes and. However, I think it's really important to start recognizing, can hormones be involved here? Is there more of a root cause issue with hormone imbalance rather than just a serotonin deficiency? And so it is a very tricky conversation. And I think it's not a tricky conversation. Sorry. It's just, it's nuanced and it's a long conversation, I think, between doctor and patient. But I think, to sort of, again, empower your community, it's about really asking your doctor questions to them as well. Like, how familiar are you with perimenopause? Because some doctor, because this is so in the limelight right now, a lot of people are learning about it. But there's a lot of doctors that still don't know, and they're terrified of hormones because of lots of issues that have happened with research that maybe we'll touch on. But I think just as you're in your late 30s and early 40s, if you're starting to notice symptoms with mood changes, irritability, changes in sleep, having the question in your head of, could this be hormonal? Could this be early perimenopause, is really important to just have in mind. And ask your doctor those questions. So if they say, oh, actually, I really don't know a lot about menopause, but here's a prescription for Lexapro, they're not wrong, but they just you might want to talk to someone that is a little bit more experienced with perimenopause and menopause, because I do think mood changes are one of the most common things that will happen in early perimenopause. And I also just quickly, could we just talk about some definitions for your community? So menopause really is just the definition of menopause is it is the 1-year anniversary after your last menstrual period. So menopause actually occurs in one day. It's 365 days after your last period, with having no period in between, obviously, because it was your last one. Perimenopause is the period before that, which can be 5 to 10 years. The average age of menopause is 45 to 55. So, sorry, the average range. And then the average age is actually at 51. Perimenopause can start 10 years before menopause. So if the early normal age of menopause is 45, that means that technically a woman at 35 could be starting to feel perimenopausal symptoms. So I think that's just important to know. But again, because of Instagram, I just like to make sure that you don't just consider everything that's happening to you to be perimenopause. If you're having heart palpitations, anxiety, all of those things, we need a doctor that can look at all of those things and know what the potential root causes and treatment are for those things. So I hope I answered your question.
No, that's great. Super helpful. Thanks for the framework on that, because I think, people don't even think about it maybe until they're 45, 46, and they're like, maybe that's what's been going on for a couple of years.
Yeah.
I think there's this negative connotation too with you're hormonal, or that's kind of what we hear, and almost like it's a curse or something bad is happening. And I love how you reframed it to, hey, there are some changes occurring. Let's reframe it. And this is an opportunity to take care of yourself so you can set yourself up not only to get through the remainder of perimenopause, but how are you going to enter in menopause and what considerations need to be there, not just for your symptoms, but your overall health, like your cardiovascular health, your bone health, etc.
Absolutely. I cannot stress that enough, really, truly. It's so important. And I think culturally, for decades or hundreds of years, women are just not valued once we're not making babies. And I really like to reframe this is like an up leveling, that
Mhm.
this is our chance to really start tuning into ourselves more because the motherhood is sort of, coming maybe to an end. No, sorry, you're never not a mother,
Yeah, exactly.
but you're active children at home,
Yes.
things like that. Sorry.
Mhm.
No, there's
Uh,
no more diapers now. It's just,
yeah,
car rides and school
yeah,
plays and
There you
exactly.
go.
yeah.
That being said, like for you, Sheena, for example, we luckily are able to have babies, later than a lot of, people did, decades ago.
Yeah.
However, it's a very interesting thing that you could have a toddler and be fully in perimenopause, too. And so your body's doing all sorts of things. You've just had a baby and you could be having perimenopause. And so it's important to recognize that that can be challenging, but it's not a curse and it's not a bad thing. And I think when you just bring up something really important too, that this is just, it's been framed as this negative, you're getting older, we don't care about you anymore. And I think, thank goodness the conversation is shifting on.
Yeah, and I love how you've done that, with your I mean, obviously, I get to see that, and it's so refreshing to know that there are providers out there, including you, who like, Hilary will text a patient, she'll answer a message in a portal, she'll do that over the weekend. Like, these are things that, unfortunately, in our traditional healthcare system are not available. It might be a medical assistant who's talking to you in the portal and you're not even talking to your provider. And that's a whole special kind of care and healing that I think is really important during midlife when women are going through perimenopause and menopause. And I think when our clients, when we have conversations with them and they go to their primary care doctor, they're offered an SS or they won't offer additional lab work. And then maybe they go to their OBGYN thinking, okay, that provider is going to have all of the answers. And then they're met with kind of the same resistance. I think there's a little bit of white coat syndrome because we're so used to thinking our providers know everything, they've been trained on everything. So, what are like one or two questions that they could ask their provider that could get the dialogue going in a non threatening way? Is this perimenopause?
Yeah, that's a great question. I mean, again, I think it's important to just ask them, like, have you had any menopause training? If for more of a primary care doctor. For a
Mhm.
gynecologist, I would just say, hey, I'm reading a lot about perimenopause. I'm so interested in this. What is your approach? Just
Yep.
ask.
Yeah.
Because I will say the conventional treatment for perimenopause, and this is still recommended by the Menopause Society, is birth control pills in perimenopause for most symptoms. And it's not wrong. It's not my first choice. However, birth control is still very important. So I don't want to stress that birth control in and of itself is not an issue because you can very much get pregnant in perimenopause. But when we're talking about symptom management, birth control pills are not my favorite. And yet that is still the recommended conventional wisdom.
Mhm.
And so, birth control pills are really the answer for every hormonal problem in conventional medicine. Anything you have, acne, heavy periods, migraines, well, maybe not all migraines, but a lot of pain, the answer is always birth control pills. And what birth control pills do is shut down our brain to ovary axis.
Mhm.
And it just completely shuts the whole thing down. Whereas my approach is much more, well, of course, birth control needs to be prioritized. But when we're talking about symptoms, really lifestyle, number one. Lifestyle is number one for everything that I do. So
Mhm.
really focusing on sleep, on your nervous system and stress management, nutrition, your body movement, your mental, emotional, spiritual health, but then as needed, using some bioidentical hormones. And obviously, it's a personalized approach, but I think that that tends to help people more. It's getting more to the actual root cause, which is that hormones are generally declining in perimenopause. And so we can get into some of the nuances of that if you want to talk about that. But
Yeah, we definitely like to talk about treatment and what is hormone replacement therapy or menopause hormone therapy, as it's called now. Things change all the time. Yeah, just different formulations of like estrogen as an example, and tell us about what progesterone does and how it's going to help people.
yeah,
School is
absolutely.
in session. Give us the lecture on. Tell us all about the hormones.
Yeah, well, and I think it's important to just talk first about I gave some definitions and ages there, but what happens in perimenopause first is progesterone gradually declines. And those are usually what women will find are their first perimenopausal symptoms. And the signs of progesterone deficiency are anxiety, irritability, really significantly worse PMS, palpitations, sleep disturbances, and some other mood changes. And so often I will treat patients often in early perimenopause just with progesterone because they're not necessarily having low estrogen symptoms at that point. Progesterone makes this, like I said, very gradual decline. It's fairly linear, whereas estrogen goes on a massive roller coaster, which for 5 to 10 years. So everyone thinks like, oh my gosh, I just need some estrogen and I'm going to feel better. And that can be true. And for some people, it's not because you might have a really high swing in estrogen and adding more estrogen on top of that can be uncomfortable. Progesterone is very well tolerated. And sometimes I will cycle progesterone. So just in what's called the luteal phase of the cycle, which is from ovulation until your period, that is when progesterone should be the dominant hormone in our cycle, and that it tends to be too low in perimenopause and in relation to estrogen is especially too low. And that's where a lot of that PMS and the irritability comes in. So often women will just benefit from it having it 2 weeks out of the month. And some women I give it to all month. It can be incredible for those middle of the night wakenings, which I think is just one of the first things that really wakes women up is like, I am up at 2 or 3 in the morning for an hour every single night. And so it can be really helpful for that. Progesterone is sort of known as nature's Xanax. I don't want to give it too much of a of a euphemism here, but it is sort of a calming hormone for 90% of women. Just there are 10% that don't respond to that. But the majority of women, it is very calming. Now, in terms of estrogen, estrogen can be low in perimenopause. And the symptoms really that are common for estrogen deficiency are the hot flashes and the night sweats. Those are the two most common. But so many other things. I mean, if you look up, you could just find like a scroll of symptoms that are related to estrogen being low. Joint pains, frozen shoulder, itchy ears, rashes, dryness, vaginal dryness, mood swings. I mean, you name it, depression, poor libido. I mean, so many things can be related to low estrogen. It's just a trickier prescription and, dosing and all of those things because of this roller coaster that estrogen is doing in perimenopause. So sometimes it's a trial and error. You try it and you're like, oh, didn't feel better, felt worse, and then you just stop. But the progesterone tends to be very helpful in early perimenopause. And then we'll add estrogen later as needed. Estrogen, my preference, progesterone, let's start with there. Progesterone is an oral pill. It's called micronized progesterone. It is bioidentical. It is the same hormone that your body makes, and it's very easy to take. It does have peanut oil in it. So if you're allergic to peanuts, that is an issue. You might need to get it from a compounding pharmacy, and they will make it without the peanuts or peanut oil. But yeah, and you take it at night and it helps with sleep. You can take 100 to 200 milligrams of progesterone at night. Estrogen comes in a variety of different formulations. My preference is transdermal, which is usually in the form of a patch. It's covered by insurance, as is micronized progesterone. The patch ideally is changed twice a week. And so that has been shown to be better for absorption and to have like steady levels. It also can come transdermal in forms of a gel that you put, on your arm or your leg. I just find the patch is super easy and most women tolerate it very well. Estrogen does come orally. That is really not in favor with the current research. Oral estrogen does increase your risk of clots, like blood clots in your legs or pulmonary embolism, which is a blood clot in your lungs. And the reason for that is it has to go through the liver and can form some
Interesting.
clot,
Yeah.
cause clots. I don't know why, but yeah. So we don't really love for it to go through the liver. It's just really well absorbed through the skin. And then let's see, there's also compounded creams that have estrogen and estriol. For some women are really helpful just because their body just, works better with that. Those are not covered by insurance. So I don't usually choose those at first because why not get things that are bioidentical and covered by insurance when we can?
Absolutely.
And then estrogen vaginal cream. I just want to make sure we touch on that. Very important part of menopause. This is preventative for the genitourinary syndrome of menopause, which I won't try not to get too into it, but our vaginal and vulvar tissues have a ton of estrogen receptors. And as we lose estrogen, those tissues can become dry and they will atrophy actually. And so it will also increases our risk of getting UTIs. And so women will find all of a sudden they're getting UTIs in menopause. And this is a very important part of menopause care is keeping that tissue, having lots of local estrogen in that area is really wonderful for that tissue and keeps it.
There you go.
Is that the same for I'm gonna jump in real fast. Is that the same for testosterone cream as well? Like if women wanted I feel like, Gwen, help me if you there's a Dr. Rachel Rubin, I think.
Yeah.
She's doing a lot
Love
of work with testosterone. And I feel like she's mentioned some things with like, we just were new to like, wait, testosterone should go down there? Like what's happening?
Yeah, good question. Well, testosterone in general, we should talk about as well. It's a really important part, in my opinion, of menopause hormone therapy. It's usually after we've sort of in my practice, I really like to even out their estrogen dose first before we start testosterone. But I think one of the things I haven't touched on yet, which is so important, is that probably the most common thing that women feel in perimenopause is that they just don't feel like themselves. That has been what's even been shown in studies, and that definitely speaks in my practice. And so testosterone can play a big role in all of it. Of course, progesterone and estrogen are sort of the key players. They have the spotlight, but testosterone can be so important for a few reasons. One is libido. That's pretty obvious. It can be really helpful for libido. And a lot of women speak about that their libido just felt like it went off a cliff, like from one day to the next. It just was kind of poof, gone. But other times, people are just loving it because it helps them build muscle, which is a really important part of menopause care, as well as just longevity. Muscle is the organ of longevity. I'm sure you guys talk about that a lot.
Yes. We love it.
Yes, it's also what's going to help your metabolic health, which we are going to talk about towards the end, I think. For women, putting on muscle is difficult, period. But in menopause, it becomes even harder. And so we need everything on our side with that. So testosterone is helpful for building muscle. But I think the thing that my patients seem to love the most about it is it kind of gives you your mojo back. It's hard to pinpoint exactly what I'm trying to say, but like vitality and self-confidence,
Mhm.
testosterone can be so helpful. And so women don't even know they were missing it. And then a few months in, they'll be like, I feel like I used to feel, and they just didn't really know they were missing that part of their vitality, their mojo. I like mojo the best because I think it's,
Mojo's good. Yeah. Yeah.
and I think people are worried it's going to make them ragey and like a bodybuilder. And we're not talking about crazy high levels. We're talking about giving your body the hormones that it was making naturally. We're just giving them back. So same with progesterone, same with estrogen. We're not giving you crazy high doses here. We are giving you levels of hormones that your body was used to seeing for 30 years.
Right. Yeah, it's like having supportive pillars that you've had your entire life just all of a sudden go away, and now you're like you're just putting them back. Like that's a great,
Precisely.
yeah,
Precisely.
awesome.
Okay, and then back to your question, testosterone can also be very helpful to be applied locally in the vagina and vulvar tissues. Testosterone does convert to estrogen. So, actually, every molecule of estrogen or estradiol, which is our predominant form of estrogen, every molecule of estradiol in our body actually comes from testosterone. And so, testosterone locally placed down there, applied down there, is very helpful for that tissue. Some of it will convert to estrogen, which is helpful, but the testosterone also can be a great way to keep that tissue vascular, to keep to prevent dryness, and to kind of help the aging process down there. I don't know how else to put it, but there is an aging process that happens down there. And I say to my patients, I'm like, you want to keep that area young or not?
There you go.
I can't imagine you're met with much resistance there.
Everyone's like, yes, please.
Yeah.
Sign me up. Testosterone is not FDA approved, however, in women
Yes.
yet. I'm going to put a big yet. I think that is bound to change, I hope, very soon, because the data is very clear. So that is a tricky medication to get covered by insurance.
Mhm.
So I prefer to order that from a compounding pharmacy that I trust. I think compounding pharmacies get a lot of bad rep, but you just need to make sure a doctor has one that they trust. And I really trust the one I use, and they make it in a way that is pure, a good, it's not in like a cream filled with lots of other chemicals and things like that, but it's also gives you a reliable dosing system, because the way that a lot of doctors prescribe it is they are prescribing male testosterone, and you're supposed to put like a dot of it on your skin. And to me, testosterone needs to be dosed very precisely. And so just saying like a pea-sized amount is not my preference.
Right.
Right. Wow, that's so interesting. I
Yeah.
like how are you met with like a lot of resistance at first from your clients when you're talking about HRT, in terms of like if you bring up testosterone, like is there still that kind of stigma around like whoa, like I don't need testosterone, or it's going to make me, like you said, turn into the Hulk or grow facial hair or all that fun stuff? Like does it
Yeah.
take a lot of convincing, or is it kind of, are you finding that people are more receptive?
No, but there are a few. I would say most of my patients are very well educated, and they
Nice.
are on all the Instagram accounts. So they're
Yep.
like asking for testosterone before everything else,
Okay.
oftentimes. And I'm like,
Nice.
hold on, slow down. But yes, I do, they usually just say, like, well, why would I want that? And so I give them, sort of my three big reasons. And usually it's the mojo one that makes them the most motivated. But yeah, some people are they really want their libido back, which I think is also an amazing thing. I think we tend to not talk about libido much in women's health, and we think like menopause means our libido's gone forever, and that is absolutely not true. If that is a priority for you, you can be having
Yes.
absolutely amazing sex in the second part of your life. So don't let that go if that's something that's a priority, because I think we tend to not prioritize that for women, and yet for men, I mean, come on.
Yeah. That little blue pill, right?
Yeah. Like every commercial is about male sexual health.
Yeah.
Like, women are 50% of that equation, often in heteronormative relationships. So, yes, that's an
Well,
important
that's
thing to
a
ask your
great
doctor.
explanation about everything, the progesterone, estrogen, and testosterone. And as you heard from Dr. Bassett, is that, if you would go into your regular, and once again, I'm not bashing like your regular primary care doctor, but this does require finding the right formulation, prescribing it at the right time, at the right dose, and it requires oftentimes adjustments to get
Oh,
that exact dose for for your body. This isn't like just one prescription. Here it is, and I'll see you next year and I'll check in and see how you're doing. And I think that's oftentimes what we get with our conventional primary care providers, That's how the system is set up. And you get that dialogue with someone like Dr. Bassett. You get ongoing appointments for a full year. And this isn't just looking at your menopause or perimenopause symptoms in a vacuum, it's as you as a whole person and how is everything interacting. And I think that's what everybody deserves. I don't know that everybody gets it, but I do appreciate that on Instagram, we do have people like Rachel Rubin and Mary Claire Haver who are getting the dialogue going, and some really savvy patients coming into you, like you said, who are requesting testosterone or other things, which is, not all physicians like that. So it seems like you're okay with it because you want informed patients. So
Absolutely,
yeah,
absolutely, and they teach me a lot, so I'm always looking things up and just trying to stay current. It's about, the doctor-patient relationship really should be more of a partnership. It shouldn't be so, like, down, "You do this, I tell you to do this, and then let's see what you did 3 months later." I mean, I really wanna link arms with my patients and partner with them because this is a challenging time, when you're so helpful with my patients because the lifestyle parts tend to often be the hardest because we really have to prioritize time and effort there, and yet it absolutely is worth it because it will help your menopause transition, I mean, a millionfold if you can prioritize these lifestyle pieces. I mean, hormone therapy is key, but, prioritizing your nutrition, your metabolic health, all of those things impact your hormones. And so, we tend to, even if we don't love conventional medicine, we're still used to that feeling of like, oh, I get to go and then I get to feel better tomorrow. And we're used to
Mhm.
Amazon delivering something tomorrow. And yet this is really, it's a process, it's a journey and sort of honoring your own body, tuning into it, giving it the time and space that it needs is so important. And it will actually benefit you through the transition, but it will also win-win, it will benefit your long-term health, truly.
Yeah, it's interesting from like a client perspective, right? Like they come in and like sometimes you just want to feel better. So you have that one option of like going to the GP, and if it is one pill, right? Or it is the birth control pill, sometimes you're in your head, you're like, I just want to feel better. Like I'll start that now, right? And I think it's great to have all the options available, like knowing which door you want to walk through. And sometimes the door you want to walk through feels like the one that's most daunting, right? Like I don't want to start an exercise routine. I don't want to worry about my nutrition. I just want to feel better right now, right? And ultimately, we can't make that decision for people, but at least now I love that people have an option like you to go to and be like, hey, I want to just like if I want to do this, I know there's many pieces to this puzzle, and like I want you to help me with the puzzle. And it's just nice to have that support. That's just awesome.
Yeah, thank you. And for me, it's a yes and, I do give people hormones like day one,
Yeah.
and we prioritize the other things at the same time because it is important to feel better and have like a little bit of a, it isn't, I mean, there might just be deficiencies that need to be taken care of. But I think when you just let go of all of that other stuff is where we're missing a huge opportunity for really long-term health, but also just that prioritization of self, really. But it is a journey, right? As you guys know, I mean, lifestyle change is so hard. It's hard for all of us. So I do think the tricky part of this is that there's just a lot of shoulds out there, and you see those memes about protein on Instagram, and it's your full-time job trying to get your protein
yep,
in every day, and I feel that too. I get it. And so, I think it's a balance. It's a balance of like, let's not stress ourselves out by trying to prioritize ourselves.
right,
So,
exactly,
keeping that in check, keeping it in balance, making small incremental changes that are moving the needle, right, 1 degree every day. And rewarding yourself for those
yes,
changes. My goodness,
Celebrate the small wins. There are no small wins. Celebrate every win, right?
right.
big time,
Yeah.
big time.
Yeah.
Yeah.
I love it. That is fantastic. So, Hilary, I know we're close to like finishing our time with you, which is so sad, but you can come
No,
back for
that
a part
so
two. We
fast.
promise. Um,
Please.
but I did want to be considerate of your time. But if people
Thank
want to
you.
find you, how can they work with you? Or just tell us what your Instagram account is, and then we'll talk
Oh,
about something we're doing together after that.
yes. Yes, thank you. Well, thank you for that. I'm licensed in California, so I'm only able to take care of patients in California, but you could still follow me on Instagram for education and, menopause tips and as well as just wellness tips. My Instagram handle is heart.of.wellness. My website is theheartofwellness. And Gwen and I are doing a course that's starting in a little less than 2 weeks, right? 2 weeks?
Like 9 days.
February 19th. We did this last year. This is open to anyone, so you don't need to live in California. And it's a course on metabolic health, which, if you don't know what that is, you can find out on my Instagram or Gwen's Instagram. But it's really about how does your body take food and turn it into energy. Sounds not that interesting. It's super crucial for your total body health. We're going to wear continuous glucose monitors. This plays really into hormone health. I don't think most people realize that. That's probably a big difference between conventional medicine and functional medicine. But metabolic health plays a huge role in hormone health as well as aging. And so if you care about your hormones and longevity, metabolic health should be one of your top priorities. So yeah, you could join us. It's going to be 6 live Zoom sessions, and we're going to share our glucose curves and about mitochondria, and you're just going to be riveted.
People loved it. They really did. Last
Yeah,
year, people were like,
everybody absolutely loved it, and I absolutely loved it last year. So I'm looking forward to doing that
yes,
again. And you can find that linked on my Instagram, and I'm sure on the Beyond the Box.
Instagram page. Yep. And then we'll make sure we put it on the YouTube portion of our podcast. We'll link that in the description, or people can DM us. They can find us at Beyond the Box Nutrition. So I think that is it for today. We so appreciate you being here. Oh, one last thing. I was thinking we have to have a closer, right? And Sheena and I haven't even talked about this. And if we change it, but if you had to give one tip to women, one of our themes is like real bodies, real life. What piece of advice do you want to give women? One piece of advice about their bodies and how to either appreciate their bodies, love their bodies, be a little more body neutral, something to elevate their relationship with their bodies.
I love this question so much. I think, I have so much to say on this. I'm trying to give one nugget. I think just we have been told to be small and to play small. And if we could just shift our mindset about that, that strong is really important and it is the key to your longevity and to anti-aging, if that matters to you. But I think just embracing the female body is such a miracle. It really is. And the way that we have been conditioned to speak to ourselves and to play small and to just run on the treadmill for hours to be small, let's just let that go. Really, truly. Let's let that pushing all that cardio and just really focusing on the beauty of our bodies and being strong.
Love it. Thank
Love
you.
it.
Great
Very
way to
cool.
end. Thank you so much for being here.
Thanks for
Thank you,
having
Dr.
me.
Hilary.
You're
This was
so
awesome.
welcome. Really great to be with you guys.
Thank you.